now say that I am privileged and honored to introduce Dr. Girdhar Gyani sir, who is considered as the father of quality in India. I think both NABH and CAHO, kudos to both these organizations that we have a streamlined quality system in a country like India. I made a mistake. I am not a mistake. An adverse event reporting culture is possible if there is an accreditation in your organizations. Dr. Giridhar Gyani sir is the Director General of the Association of Healthcare Providers of India. If I have to read his introduction, it will take me a lot of time. So, sir, we all know that you have played a pivotal role in integrating quality into regulatory measures, and we are all keen to listen to you now. Over to you, Dr. Giridhar Gyani, sir.
Yes.
He's going to talk to us today about yesterday, accreditation in India, yesterday.
Okay. Thank you, Samina. And as a patron of the CAHO, I also welcome each one of you. I think, as I can see, there are over 250 people attending this, and I'm sure it is also being aired on other channels as well. So this topic of accreditation yesterday, that be precisely what I understand, is that you want to know about the journey of accreditation in our country, particularly. So let me start by saying that when we are, studying this subject of accreditation, way back when I was in UK, when Government of India sent me for training on total quality management, very small batch of 6 persons only were sent that time, 1982, very old story. And then again, I went for 1994, of course. Again, that was the major, training. So we were told that accreditation per se in the history came in 1885, when in the USA, an organization known by word New England Association of School and Colleges. So the accreditation per se, I have the notes of, those classes, was in 1885. But today we are discussing about healthcare. So in the healthcare, I think you are all aware about it, that in USA, 1951 is the year when Joint Commission was formed. But the important point here is that this initiation came from College of Surgeons. So the healthcare accreditation really started by the healthcare professionals, who were keen to, you can say certify or witness, because that time there was nothing like payers were incentivizing, nothing of that kind was available, but these surgeons wanted. And of course, before that, the surgeons also involved the Association of Physicians also. So the long story, which I will not go into detail, but finally it culminated because College of Surgeons obviously cannot be doing accreditation on the commercial basis. So it actually initiated the organization called Joint Commission, which is something like what we have in our country, NABH. So the Joint Commission launched the standard in 1951. So in the healthcare, they become the first to launch accreditation. Now, when India is concerned, before I talk about NABH, the accreditation was synonymous with what we call it International Accreditation Forum. Now, IAF is the body which came into existence, let me tell you, because of the World Trade Organization. Because World Trade Organization is a body which actually looks into how the trade happens between country to country. And it was found that a lot of countries were trying to put the barriers, what we used to call technical barriers to the trade. So they will, on ad hoc basis, decide, okay, this is the kind of standard we want. And if you are not meeting those standards, sorry, we will not be able to take the product from you. So, this kind of war was going on. And that is where, this International Accreditation Forum got created in 1993, which actually sets up, the framework that each country will have to follow the standards created by ISO, or for that matter, even if not by ISO, some other standard created by individual country, and then those standards were also adopted by those countries where the trade was to happen. So that informal arrangement started falling in place. And gradually, then IF started the program in 1998. And that is what we call the multilateral recognition from country to country. And so each country established its own accreditation board, and this accreditation board will give accreditation to the conformity assessment body, what we call inspection body, what we call certification body, what we call laboratory. So these bodies, the inspection body or certification body or the laboratory, if they are accredited by their own country's accreditation body, and if that accreditation body has signed the multilateral agreement with the IAF, that means their certification, inspection, or testing will become acceptable world over. So I think this was a beautiful arrangement to have equivalence of certification, and that means the product certified in one country need not be certified in another country, and the trade can happen very smoothly. So this is actually a very important one. And if you really ask me, the Quality Council of India was created only because of that, because that's why it came in under the Ministry of Commerce and Industry. So that is where, the journey of accreditation, you can say, started in our own country. And of course, in Quality Council of India, we have got NABCB, which actually grants accreditation to all these conformity assessment bodies. And it has signed multilateral agreement, I think, virtually in all the areas. So that is the one part now. Now, quickly, let me come back to our own subject. Like IAF unfortunately did not have any particular standard on the healthcare. And if I remember, when in 1987, the ISO 9000 came into existence. So I was that time heading the Institute of Quality Management in 1990. So when I returned back from UK, in fact, I can say that I am the first actually to write a small book on TQM based on my training at UK. And I introduced one chapter in that, how ISO 9000 applies in a hospital. So that actually became, the starting point, that some of the hospitals really started going for ISO 9000 because there was no NABH at that point of time. Anyway, that is a side story. But so, because IF did not have anything concerning with the healthcare, we got a body called ISQA, International Society for Quality in Healthcare. We are going to have the Secretary General talking to us soon here. But that actually got created in 1985. Now, let me tell you, because you are all part of the CAHO, in 1985, ISQA was not accrediting. Some of you may not be knowing this point. The ISQA was doing a role absolutely copy of what CAHO is doing. They were actually in the business of how to improve quality, how to promote best practices, how to support accreditation. Although there was accreditation of IF kind of things, so they were there to support accreditation and encourage research and education. I think these are the 4 areas Lalu just now mentioned, that is what CAHO is supposed to be doing and is doing. So that was the SQAF in 1985. They launched the accreditation only in 1999. That is what we know, that accreditation for standards, accreditation for an organization, and accreditation for the training bodies, which do the training for surveyors or assessor, what we call here. So that is the, ISQA came into being as accreditor of accrediting body, like a UNO of, the countries, So that is the role ISQA acquired in healthcare, what IAF or ILAC has for confirmed DSS body. So anyway, so I think this is the small, background. Now in healthcare, before we came to NABH, let me tell you, we had accreditation for the medical laboratories. So in a way, they are senior to us, in the sense, 1973 is the year when the Planning Commission decided that we should have accreditation for the laboratories, and that task was assigned to Department of Science and Technology. And in 1982, the Department of Science and Technology created the body called NCTCF, National Coordination for Test and Calibration Facilities. And this was renamed in 1993 as NABL. And NABL started accreditation. That time, there was no international standard ISO, but there was an ISO Guide 25 in 1990, which came. So they started doing accreditation based on Guide 25. This Guide 25 became the full-fledged standard 17025 in 1999. Now, this coincides with the launch of ISQA, 1999. But in the medical field, because we used to train as our pathologists based on 17025. In fact, I can take a bit of small credit here that first 150 to 200 pathologists were trained by me and my another colleague from DST at IIQM. And in 2003, of course, we got 15189. So that is the accreditation for the medical laboratory. It started from 2003. Now let us come to the hospital accreditation very quickly. Very soon, in the year 2000 and 2000 to 2005, you are aware about it, that some of our hospitals became known globally, very small number, of course, but they really were very ambitious. They established the state-of-art facilities, and they started attracting the medical tourists from the neighboring countries. And there were few cases where the patient came all the way from USA for the heart surgery, some from UK, and that became the talk of the town. And then we started thinking of, getting into this medical tourism. Quickly enough, in 2005, in the month of April, there was a session in the parliament, and where the question was raised by one of the members that the medical tourists want to know, how do we pick up a hospital? Because they are coming all the way. So the question was, do we have any accreditation for healthcare? So this topic was then referred to Ministry of Health. By the way, this question was raised from Ministry of Tourism. So this question then was passed on to Ministry of Health. And it so happened that 2 years before that, I was, of course, the Secretary General, Quality Council of India, and Mr. Hota was the Secretary in the Ministry of Health. He actually had problem that time. How do we impanel the hospital for CGHS? He was finding a lot of issues, concern, complaints. So he actually called me or invited me in year 2004. And he says, do you have any mechanism? So I told him, I have only one mechanism. We have certification bodies, and some of them, they do certification of hospital based on ISO 9000. We have given them that scope. And there were, I think, I remember 9 certification bodies only. So I said, you please give me your inspection criteria, and based on that, I will assign a job to these 9 certification body, and they will give report to QCI, will pass it on as it is to CGHS. And that is the way it is started. So in 2005, when this question was passed on to him, naturally he immediately recalled, and he again invited me that this is the question. Can you apply same ISO 9000 here, what they are asking for from us, the accreditation? Luckily, I had this background, as I told you, with my training in UK. And I told him that, no, this is a absolute different cup of tea. And I will really need to take the permission of our chairman in Quality Council India, Dr. Mashelkar was the chairman. And then, of course, that was, of course, very easy. Dr. Mashelkar is a person, he will Quickly, he didn't even think much about it. And then the task was for me to find out 5 to 6 doctors of eminence who actually can be assigned the job to write the standard. I, being trained on the framework, I naturally was helping them, and I ultimately identified 5 doctors, and one member I took from the BIS, a retired person from BIS. I thought this person will help them to, do a bit of writing. So that is the way journey started, and 27th June, as people keep remembering in the NABH, is the birth of NABH. Though birth of NABH actually took place in April, May itself, because the board approved so and so. But the first technical committee meeting happened on 27th June. So I think people take that as a starting of, the birth of the NABH. So anyway, I think let me tell you, writing of the standard for the clinician, and all of them were very reputed. You know it. Of course, Dr. Pawan was the chairperson, Murli was the co-chairperson, Dr. Murli. So, but I don't know, there was so much enthusiasm at that point of time. They will, every Saturday, Sunday, they will assemble, sometimes in Delhi, sometimes in Bangalore, sometimes in some other place, religiously. And I will be, of course, sitting by side of them, just not in every meeting. I somehow, first meetings, I sat with them, and then, of course, they took the journey of their own. And it was then they almost, I think they took from June to December, I think they almost finished the work. And January 2006, we submitted to our, Quality Council of India as a, that formality has to be filled up. And it was approved by them in 2006. And then in February 2006 was the formal launch of NABH program in our country. And let me tell you here, enthusiasm was there in them, with me also, everything was there, but, it was not easy to tell hospitals to come forward and apply, because this standard was developed to meet that requirement of global requirement, because medical tourism. So obviously, this, standard was developed based on, what our committee studied, Canadian standard, JCI, Australian, these 3 standards I remember, they did the study. So obviously the standard, when was seen by some of the hospitals, they say, come on, this is too much for us to apply, and what the hell is going to do, what benefit we will have, all sorts of things happened, So it was, what I'm trying to tell you is, but because of that enthusiasm among these 6%, or let me call now 5%, because BIS person later on, one, the standard was there, but he naturally parted way, So these 5%, me and Dr. Yashpal Bhatia, I will name it here, because he was also a very key person that time, and we named him as a first chairperson of the accreditation committee. So we used to virtually do 3 to 4 programs in every month, sometimes even more than that. We will just go in different cities, conduct this awareness program for half a day, mostly one day. I think we really had to put a lot of hard work, and anyway, in the 1 year, if I remember, hardly 30 or 35 application came. And in that also, in 1 year, when the second Quality Council of India conclave came, we thought we will award this certificate in that conclave. And it so happened only 5 hospitals could qualify or could get accreditation, So let me also tell you that when February we launched the standard, MIMS take the credit of being the first hospital to apply, MIMS Calicut. I gave them the weightage because, we were really waiting that next people start applying, and when they started applying, we had sigh of relief. Okay, somebody at least has come, But of course, anyway, that onwards, 37 people came. Again, very important point here is that I had one person from the army background who had served under Dr. Abdul Kalam when he was the DRDO chief. I told him that we want to invite for this conclave some very senior person. I didn't think of inviting Dr. Abdul Kalam. He says, why not we will go to meet the president. I said, come on, president will now come for conclave of Quality Council of India, which is a very young baby at that point of time. He says, why not come with me? He took time, we went and met him. And surprisingly, he says, yes, this is something very unusual. Quality Council of India, I will come, don't worry. So I think that really became the turning point. Once he awarded 5 certificates, I tell you, we had rush of application from there onwards. So I think I give credit to these small points that in our own country, the way things happen and the way accreditation got into prominence. Anyway, I think later on, of course, this is a journey. I will say that we trained, of course, 100 assessor, by the way, in that 1 year. After launch of the standard, we knew that we need assessor. So we launched 100 assessor. A small point here once again, that I wanted to follow the American method, that 1 clinician, 1 administrator, and 1 nurse. So some of my clinician friends, not only from technical committee, but from outside also, they did mention to me very strongly that, at this point of time, Indian nurses really do not have that kind of, acceptance that you want to bring them as assessor. I really was in two minds because I thought they are the best people. I know they are in the healthcare. But I again kept on thinking, and finally, I don't know, something happened within me. I said, no, we will follow American model. Let the nurse be the permanent part. I think sometimes I feel what Lalu was mentioning, that, of course, the NABH today has done wonders for our country in terms of patient safety. I will say that decision of bringing nurse as a assessor along with the doctor and administrator, I think also did some contribution to empowerment of nursing community. So I think this good decision happened. And finally, I think, because I know that I am little overshooting the time, in 2008, after accreditation was given to 5 hospitals, Dr. Abdul Kalam was there, we went and met Ministry of Health. And then we pursued them that, like in each country, the payer do recognize the accreditation. And they agreed, okay, let CGHS impaneled hospital, if they get accreditation, we'll pay them 15% more money. So that is another big turning point for boosting to the NABH accreditation. I think I will stop it here, because rest of the journey, I think you are all aware about it, because I think 3:30 was supposed to be my finishing time. But anyway, I'll be listening to all of you, and in between, wherever required during panels, I'll come back again. Thank you very much, and all the best on this International Accreditation Day, 9th June to, anyway, 29th June, we are celebrating. Good. Thank you very much.
Thank you. Thank you, Dr. Girdhar Gyani, sir. Thanks a lot. Please do stay with us through this webinar. We'll be very grateful to you. And as we realize that standing on the shoulders of giants, we just don't only see the future, we see the past also, how the journey was. It was very interesting, and we could have listened to you for a longer time, if not for constraints of time.